Good evening, everybody, and welcome to RAMP, Real Access Motivates Progress, live Wednesday night podcast. We are so thrilled that you've decided to join us again tonight for some important conversations highlighting resources and organizations across the state and across the country, letting everybody know what is out there that you can use if you happen to end up in the disability community or the elder community, or just something you may need for a loved one. So tonight is no different. We have a great speaker with us tonight who you've seen her face before because like me, she wears many, many different hats. So we would like to welcome Kyla to the show. Hi, Kyla.
Hi, everybody. It's great to be here, Tina.
I am so excited to have this conversation with you again. You're like me, you wear very many hats. So tell everybody who you are and what you do.
My name is Kyla Walters Clinton. I serve the public as the Director of Race, Equity, and Community Engagement for the Executive Office of Health and Human Services. I also serve our community as a steward of the Providence Shelter for Colored Children Foundation, as well as serve on a number of other boards and support the community in a various number of other ways, but you'll see me all around town.
Yeah, like I said, you're just like me. You are here, there, and everywhere, and make your presence known. But you do such important work, and that's the important part to all of this is the important work that you do. So, what have you been doing since the last time we had the conversation? Because we had you on a couple of weeks ago talking about the Executive Office of Health and Human Services, and I just got tongue-tied when I tried to say that. But tell everybody about a little bit about the unwinding. Let's just talk about where we're at that, just so kind of give a quick update to everybody of what's going on with that.
The unwinding, which, we refer to it now as Medicaid renewal. So Medicaid renewal or redeterminations will begin April 1st. And we want to make sure that people are aware that the same system that they would go through before COVID is just starting again. So the same application process that you would go through annually will begin again April 1st. Children and families will begin in 2024. So we're really looking at single adults and older adults and focusing on communities that receive Medicaid. So people, we want people to be really aware of the mail that's coming into their home, pay attention to it. It will let people know when they need to reapply or recertified. A number of our community members will be passively recertified. So information will be coming from other sources and they will be passively renewed. But some of our community members will have to provide updated address information and financial information. So what we're asking the public to do is make sure you go into your Health Source RI, update your information, update your address and your contact information, and make sure that that is up to date so that you can receive any following notices that tell you when and if you need to renew.
Yeah, and if you're seeing this and you have an elderly neighbor or a person of disability who may not, know or check their mail, just ask them. Say, did you go in and renew? Did you make sure you checked up on things? Be a good neighbor, check in on them, make sure you're all talking to one another, help each other out, and making sure that these forms get filled out, because we would hate to see anybody get dropped off in any way, shape, or form and not have health care, because as we all know, anything can happen at any day, and we want to make sure that we're checking on each other and we're making sure that we're covered. I heard you're hosting a diversity cafe. Tell us a little bit about that.
Oh, that's going to be so much fun. On the 28th, Rhode Island SHRM will be at the executive office, and we brought a number of great friends and community partners that are industry experts to talk about different areas of DEI. And so we are examining the different communities, like the LGBTQ community, and providing a training there, providing a training in the college space in regards to DEI, and really looking at DEI in your workplace. So please take a look at Rhode Island SHRM and look at their website, and you can find out more details. You can sign up to participate, and we'd love to see you there.
And for those who may not know what SHRM is, can you give us a little explanation of what that is?
I sure will. Rhode Island SHRM is the Society of HR Professionals. And one of the reasons that a lot of people in the community reach out to me is because they know that when I'm involved in work, I find a way to get hands-on experience in whatever I'm doing. And so when I started to serve the executive office and was in this role that really intersect DEI and HR, I went to volunteer with Rhode Island SHRM, which stands for the Rhode Island Societies of HR Professionals, to make sure that I was really getting inundated with the issues that HR professionals have to deal with, and the intersection of diversity, equity, and inclusion when it comes to HR. So hiring practices, onboarding practices, affirmative action practices. And so this gave me the space to connect with other human resource professionals that are also experts in the world of DEIA, which also stands for accessibility.
Well, we changed that around a little bit. We call it IDEA: inclusion, diversity, equity, and accessibility. The idea is to open everybody's perspective. So we're hoping that takes on some shape, because accessibility is important in every level of all of this. But let's get to the topic at hand and what we're here to talk about tonight. With all that you do, why get involved with the Rhode Island First Civic Index?
It is for the same reasons. When I was introduced to this role in the executive office, I was charged with impacting the landscape for all health and human service agencies when it came to focusing on health equity. That's a tall order. Those are a lot of people and a lot of lives that would be impacted. And so, like I said before, I really like to make sure that I get hands-on experience in all of these areas. So there were two things that I did. I joined the Economic Progress Institute board to really focus on policy, but I followed and I got involved with the Rhode Island Civic Health Index because they were really focused on listening to the whole entire community of Rhode Islanders, visualizing and providing a visualization of what Rhode Island really looks like, where we are today in our engagement in our civic health, and how we can move forward to become a part of the beloved community that Dr. King references in his work. And so that's one of the reasons that I got involved. I was asked to just provide some information as a community volunteer. And so I did that. And I got really interested on how the Rhode Island Civic Index planned on surveying Rhode Islanders. How are they going to capture all the voices of Rhode Islanders? And so when they came back and asked me to participate in that research, it was a no-brainer for me because it would give me an understanding of how to do that for the executive office.
And that's so true. And, I'm always one who likes to break it down for those who may not understand. So, explain to people exactly what the Civic Health Index is, what it entails, and what it gathers information for.
So what's really, really cool about the Civic Index is that it's the first of its kind. 30 other states have engaged in a Civic Index in their state, but Rhode Island did it for the first time in 2022. So that was really exciting to be a part of that. And what it does is it was a way to understand our strengths and our communities and how we are defined, how we are organized, and how we use those pathways to address public problems. That is a definition that was actually from the National Conference of Citizenship. And I learned so much about where we are right now. We are number two, I think, in terms of people relating to one another. We have high participation in government, but there are some significant barriers. And that's important to my role because in order to effect change, you have to be involved in policy work. And so we know, and Tina, you know this firsthand, that accessibility to the state's platform and those legislatures is hard. And it's not, everyone does not have the same accessibility when it comes to standing up for a bill, when it comes to being a part of that system. So that was a really great way to listen to how people felt about that work.
It's so true. Just recently, there were so many bills last week on housing and transportation and stuff going on at the State House and talking about accessibility in all multifaceted forms. I couldn't get to the State House because my van is broken, so I couldn't testify on a lot of those bills. Yes, I could do written testimony, but I don't believe it's the same as in-person testimony. And then it's accessing the State House itself, which there's one way in and one way out for anybody with a mobility aid. Or, if depending on where you are or where you're at, can you get to the State House? Do you have the means to get to the State House? Do you know how to testify? Do you have somebody that can support you? I mean, testifying, they want to hear your true life stories, but it is nerve-wracking for somebody doing it for the first time. Do you have people in your community that could talk you through that process, that could help you stand up, educationally for the bills that you want to stand up for and what you want to say, and what will be impactful of you say once you get there? It's such an important role that we all should have take. It's having the peers around us in our own communities, no matter what community that happens to be. It's us all working together to break down those barriers.
Agreed. And what we also learned is that there is little training. There is little training for students to learn about those systems. And prepare to be able to stand up, like you said, and represent themselves and represent others in those systems. So the Rhode Island Council for the Humanities is working to bring civic training to youth. They are also really focused on creating a democracy that represents voices from all communities. And that's why this is an important topic for your show, because it includes everyone's voice. On the website, on the Rhode Island Council for Humanities website, you can find the index, and it begins with a land acknowledgement, a beautiful land acknowledgement of the Native community that was here before us, that represents Rhode Island, as well as the slaves that contributed to Rhode Island. And I think that was one of the beautiful things that was a benefit of this volunteer work because it gave me an opportunity to be around other like minds from all different walks of life that were dedicated in civic health of Rhode Island.
Yeah. You provided us with a website and a short video. We're going to have that dropped in the chat right now so people can access both of those. But give us the website and explain a little bit about what the video is going to show people.
So the video is going to give you an executive summary of the Rhode Island Civic Health Index. It also points out some key indicators. It's focused on community well-being, community participation, like social connections, community participation and public participation, community participation when it comes to collective understanding, and community participation when it comes to engagement in government. And so I'll go back to the heads of these different areas to break those down a little bit more. So when we're talking about well-being, where we are now is that we know that there are racial disparities in communities when it comes to well-being, and there's barriers to civic health across the state. We know that there are health disparities based on where people live and social determinants of health, and that was so connected to the work that I do every day. Communication and community participation with social connections. People are really, really connected to their communities, to their neighbors, to their family members, and that's one of Rhode Island's strengths. So we can be proud of that. When it comes to public participation, Rhode Islanders' public participation kind of lags compared to other states, according to the US Census indicators. But how we expand those measures will help us as we go on to do more research in this area. We have strength in community groups and non-governmental civic institutions. Rhode Islanders maintain public participation even during the pandemic, but many factors still act as barriers, including social insularity. When it comes to the collective understanding, Rhode Islanders' collective understanding of civics, history, and media all have significant room for improvement. Race and age may be a big factor to the perceptions of like the state's history, including monuments and city squares and neighborhoods. And many Rhode Islanders felt frustrated due to the lack of relevant information and local coverage from their state media outlets. And then when it comes to engagement with the government, Rhode Islanders are engaged with the government at high rates compared to the rest of the nation, but many are concerned about nepotism and corruption. So we've got some work to do.
Yeah, we definitely have some work to do between language barriers, racial barriers, accessibility barriers across the state. What is the goal? What would you like to see? Like if you had your own little wish list and Kyla could have anything she wanted, what would you like to see? How would you like to see this all turn around for Rhode Island?
Well, this is exactly what I'd like to see. Partnerships with organizations like the Rhode Island Council for the Humanities provides the space for safe conversations. And it's those places and spaces where we need to have conversations about government, where we need to have open conversations about our communities, about our neighborhoods. Our neighborhoods are changing all the time. And so if we just think about the influx of refugees and the histories that they bring and how that blends into our fabric, it would be better to have those conversations instead of just letting people try to assimilate. You know, it would be better to be able to have those conversations with people in our community where I can see, like, there are some places where I see a lot of folks running businesses out of their home. And if you think about where they came from, that's something that they were used to. But in our communities here in Providence, you're living in a residential area. And I think that conversations like that would help people to find the resources that they need to be able to stand up and have a business that, have a business legally, without being afraid. And I think that there's just a lot of fear and a lot of lack of communication. And I think there's also a lot of misinformation out there. And so if I had my wish, it would be to have a couple more people like myself on my team so that we can engage a number of other community partners like the Rhode Island Council for Humanities. There are some other great partners out there that I'm working with right now that are creating those spaces, that are changing the way that our community connects with each other. And as we approach this digital age, where our youth are really into that computer world, one of my concerns is that they lose that ability to engage with each other and be able to listen and be able to participate in dialogue, even when the other idea doesn't match yours. You know what I mean? So these spaces are really, really important, and they're critical to the way that we relate to one another.
Well, you can always reach out here because you have a supporter and a cheerleader on my end. But I am blessed to say that I get to be in a lot of these spaces because of what I do, helping all of these communities. I mean, disability is the largest minority in this country, and we don't discriminate across the board. So I've been to the refugee center. I've been to a lot of these nonprofits that help all sorts of different communities. And I'm amazed at how much I get to learn, and opening my mind and listening to stories and having them listening to my stories is really what it's all about. It's opening your perspective to other people and learning, not judging, not guessing, not thinking you know better is good for them or not good for them. It's learning their culture, it's learning their way of life, and bringing us to a conclusion where we can all work together and we can all find a space, because we all matter and we all need to find that space together. And the more we talk, as much as we talk, the more we listen, the more we learn, and the more we're open to new ideas is the only way that any of this is going to change. And I'm so blessed that I get to be in those spaces and I can meet these so many different communities. I mean, I have been in spaces where I have no idea what anybody was saying to me because the language barrier was just beyond me. But in the end, we found a way to communicate. We found a way to make it work. And now they're some of my best people that I love to reach out to because we made it work. We found a way to make it work. We used an app that translated, and I'm sure it didn't translate correctly on everything because some of it we had good laughs over of what it was translating. But there are so many tech ways out there, and I wish the kids would get off their tech and talk to people, interact with people. I mean, kids that are sitting in the same room with each other, texting each other instead of actually having conversations. I just don't think so. How do you think we're doing? Are we really taking the steps forward, do you think?
I think that community partners like the Rhode Island Council for Humanities is helping us to make those changes by providing these spaces. I know that in the government spaces, we are making those changes little by little. And what I love is that this index really helps people to focus on and think about how they participate in their communities, from local to state government, how they interact with their friends, family, and neighbors, and realize that it's really, really important. And it influences overall well-being of your neighborhoods, communities, and your state. So I also want to mention that this work shows up. The Council for Humanities is something that people don't realize supported them for years. The Council of Humanities is one of those organizations that funds our museums, our libraries, and a lot of our public spaces. And it records and contributes to the histories that we maintain and learn about. So yes, we are making changes every day. This is just an example of some of the changes and some of the work that's going on that people may not realize is happening, and that will continue to grow. We reached about 751 community partners to do this research, and we're just going to get bigger and bigger and bigger every year. So yes, we're headed in the right direction. And where we go into the future is the next conversation. So stay tuned.
Yeah. And tell everybody how an everyday person can get involved in this work, how an everyday person can make a difference and bring their community together. Tell us some ways that we can form this beautiful community together and get engaged.
I think, and it's something that I wholeheartedly believe in. It is as important to me as going to college because it provides you with a whole different way of learning, a whole different way of educating yourself, and that's through volunteer work. Get involved in your community. Find some time to volunteer. Find some time to volunteer by yourself or with family members so that you can listen and be in tune to what's going on around you. I think during COVID, we were forced to focus our attention in certain ways. And now that COVID has, now that we've recovered, I think people are getting just back into their busy lives, and people feel like you don't have time to volunteer. Like, why would I do something like that? But it brings me the same type of gratitude that I get when I go to a artistic show or listen to a music ensemble. Giving back to the community in that way feeds me so much and educates me in a way that there's no comparison. So if you really want to get involved, if you really want to see change in your community, volunteer anywhere, and that'll lead you right down the right path.
And this is such a great timing for this conversation because next weekend here in Rhode Island is the weekend of giving. It's 401 Gives next week. Every nonprofit will, be pleading for your help, letting you know about what they do, what their missions are, what they do. I'm sure that everybody can find a nonprofit right here in the state of Rhode Island that can benefit them, that can help them, that they can learn from, and that they can get involved. And you know what? I suggest you reach out to those nonprofits, get involved in something that steps you out of your comfort zone. Learn something new, learn something from a different demographic or a different I'll tell you, it will lift your heart and it will open your mind to so many new things that you never even knew existed. So March 31st to April 2nd is 401 Gives. They're actually having a water fire on 401. They're lighting the basin downtown Providence. We already have spring going on here. It's beautiful weather. Get out, get involved, meet some nonprofits. If that's the least you can do, bring your family, go to Waterfire and meet some incredible people running the nonprofits here in Rhode Island, because I'll tell you, getting involved with them is probably the most important thing that you could possibly do than anything else. And raising your children to get involved with nonprofits and to give back is essential for them to grow up to be well-rounded people and to learn from different outlooks. Do you have anything to say or add to that?
I totally agree with you. There isn't a better education that you can give your children by exposing them to communities that may not resemble yours, and that's the best way to get involved. It's kind of like what I do when I travel, Tina. I don't stay in the city. I try to get out and go to the restaurants that are in the neighborhoods. I try to be with the locals so that I can really experience the area. And so I advise everybody to do that, and you're missing out if you don't.
I made a challenge to myself last year. I never really vocalized this to anybody, but it was a personal challenge I gave myself last year, and I can honestly say that I succeeded. I chose to make sure that I attended every festival that was happening in the state of Rhode Island last year. So I
Wow.
could involve myself in all of the different cultures that we have here across the state of Rhode Island. And I could say, other than if I was out of town, I have made every single one of them. I have made friends. I have learned. I went there as a guest. I didn't assume myself. I didn't push my way in. I went in there to observe, to take it all in. And I'll tell you, everybody should try to do that, because some of them I was very uncomfortable only because I didn't feel like I fit in. I didn't know what was the right thing to do or not, but people guided me. People brought me into the fold and they helped me along the way. I can honestly say there was not one that wasn't glad that I was there, that I was trying, that I was, involving myself, that I was trying to open myself up. And I was welcomed in the end at every single one of them. And I'll tell you, it opened my mind, it changed my perspective, and I have a different feel for when I view things, because now I can say, oh, that's part of this culture, or that's part of this, and this is what this stands for, and that's what that stands for. And it really, I encourage people, make a challenge like that to yourself. Maybe you make a challenge to make 3 this year, maybe not all of them. I mean, I if I throw myself into something, I go way above and beyond. But make a challenge to make 3 of them. Get involved, make an attempt, call a nonprofit that you never thought you would have any interest in whatsoever, and learn what they do. And that's exactly what my goal is this year, is to call every nonprofit in the state of Rhode Island. I know that's a big task. I will not complete it, but I'll tell you, we're in March and I probably hit about 300 of them out of the 700 that are in Rhode Island. So it may happen. So like I said, I mean, they're touches, they're not fully immersed, but I'm working on it.
You're a wonderful example, Tina, and I love, love, love that. That's a wonderful way to impact culture. So I might be bringing you back to the executive office to do a call for action, and you can share your Tina's call for action, or Tina's what would we call that? We'll have to think about a great term for that, but it's a great way to immerse yourself in other cultures, in a nice and friendly environment. What better way to do that? So I might have to bring you back to share that challenge. I love it.
Yeah, it was, like I said, it was so much fun, and it was such a big task to take on. And everybody who knows me knows that 97% of the time that I am out by myself. So I was rolling into these events completely looking different, completely acting different. Obviously, I'm in a mobility device, so I really don't fit into most communities. Um, and I was welcomed with open arms. So for anybody that says that they can't be welcomed, hasn't actually tried to really immerse themselves and be a guest before you're invited in to be family. Because now, like I said, a lot of them I feel like I'm family, and I am so glad that I opened myself up to that, because it broadened my perspective to all. Like I said, disability is across all cultures. So I can't help all cultures if I don't understand all cultures. So I can't go in and using what I would use on a daily basis to, let's just say, like a white business community, and say that this is the way it has to be across the board. That wouldn't be fair, because there's different cultures, there's different leads where men are the leads, or women, are have a role or whatever. I can't say it's across the board, because you have to learn the culture in order to gear your message to that culture, to that arena, to make sure that everybody feels seen and heard, and you're bringing it to where they're at and not what you think they should be at. It was uplifting to me. It opened my heart, and that's so important to the Civic Health Index, because that's really what it's all about. Am I wrong?
No, you're totally right. And people need practice at that. Because when you're listening to someone's story, there's a lot of things that are happening. You're thinking about yourself, you're putting yourself in this other person's shoes. There are just a lot of things that can happen when you're listening to someone else's story that distract you from really intently listening to the story. So it is something that people should practice, so that when they hear someone's story, they see that individual that's sitting in front of them, and they recognize that individual for the story that they're telling, and not imparting their own types of interpretations or their own personal bias. So we need practice.
Yeah, give us the Civic Index's website again so I can make sure that people hear it.
It's Rhode Island, it's rihumanities.org. You can download the PDF there for free. You can also, there were limited copies, so I don't know if there's any copies that you can get that get sent to your house. The video that's on there is a short video. I think it's like, 4 to 6 minutes or something like that. The associate director is Julia Rhode. She's wonderful, and their staff was really wonderful. Some of the partners for this were the National Conference on Citizenship, the National Endowment for the Humanities, the Rhode Island Department of State, the Rhode Island Foundation, and the Federation of State Humanities Council. They were great partners, and I'm so happy that I got to participate in the first ever data-driven report assessing the state of Rhode Island's civic health, helping to understand where we are and where we're going together. And so there'll be continued conversations. I think there's one in April on the 19th to actually have that conversation of where we're going together. And if your community was to address all the racial disparities, what would that look like? I hear our time is almost up, Tina, so I will refrain.
No, I think it's so important for the conversation. And I just want to take a moment to thank you for everything that you do in tying everything together, from the Executive Office of Health and Human Services to Civic Health Index to you are a classmate of mine at Leadership Rhode Island program. And there's so many other things that our lives have just intertwined. And we're a perfect example. We were Bannister Award winners. We were the inaugural Bannister Award winners back in 2020, was it? Or 21? I don't even remember at the point. We were the only two that became instant friends. Like, there was just something that gravitated the two of us together. Completely two people from different worlds were smashed together in this one event, and we have been friends and opened the conversation ever since. And how easy it is opening your mind up to new friendships and new people to change the trajectory of your life, because you have changed my life by knowing you. And that's what it's all about, is making sure that you're open and not missing out on some amazing people because you think they're too different, or they think different, or they act different, because you don't know until you actually get to know them. People misjudge me all the time because they see the wheelchair before they actually get to see or learn from me. That I know it's the same in every community that we have across Rhode Island. So look at the two of us that we became fast friends, and I'll tell you, you're one of the people that I turn to when I'm having a problem, or when I don't understand something, or when I need clarity on something, or if I'm just being a big pain in the ass and saying, hey, Kyla, talk me off the ledge because I think I'm overthinking this. And you bring me right down back to earth. So I hope I do the same for you at some point. But you are an amazing person, and Rhode Island is very, very lucky to have you.
Thank you, Tina. I love the relationship that we've built together, and I love how our lives keep intersecting. I cannot take all the credit. I was raised by beautiful parents in a beautiful family, and I was also trained to be a clinical therapist. So listening is some of the skills that I was trained to do. Talking people off the ledge is what I was trained to do. But what I really love that you mentioned is that the disabled community is in every community. Substance abuse and mental health issues are in every community. And so we really need to come together if we want to live in an environment that where we can impact the social determinants of health and we can change these things. We have to be able to come together and talk. And so thank you so much for having me on the show tonight to be able to share the Civic Health Index and get people aware that these conversations will be taking place. And so stay on alert and get involved and share your voice.
And this won't be the last time that you see Kyla's face, because we will be doing a lot together, especially updating everybody on, the renewing of your medical information and stuff. We will keep you updated on all of that as well, but we will also be updating you on how you can get involved and how you can be part of this. Thank you so much for taking the time tonight. I will be seeing you really soon. And again, thank you so much for all you do for the state of Rhode Island.
You're welcome. You're welcome. Have a great night, everybody.
And I welcome everybody back next Wednesday. Unfortunately, you will not see me, but have no fear. Our co-host Diana Perkins Kamada will be here next week, and she will be talking Project Insulin. I have a commitment, so I won't be able to be here, but there will be a show. So come on back next Wednesday night at 7 o'clock, same time, same channel. And I got two statements for you tonight. Be the change you want to see, and don't just sit there. Make a difference. Have a great night, everybody.